Hello, folks, and thanks for listening to the show. I am so excited about my interview today. I have Dr. Joseph Pizzorno, one of the thought leaders in naturopathic, integrative, and functional medicine. He started Bastyr University in 1978 and is a founding board member and current chairman of the Institute for Functional Medicine. He's authored numerous textbooks that are intended for NDs and MDs and other healthcare professionals, as well as multiple consumer-focused books for people like me who aren't a trained doctor. He's also the editor-in-chief of PubMed Indexed IMCJ. I have heard him speak on numerous podcasts and appearances, and I'm a big fan of his work. He also has developed a really helpful AI that analyzes 23andMe genetic data and makes health and lifestyle recommendations that I've found to be very useful. Dr. Pizzorno, thank you so much for joining me today.
Well, thank you for the very kind introduction.
Great. So first off, can you tell the listeners how you define naturopathic medicine?
Yeah, good question. So the elevator speech is we're doctors to help people understand why they're sick and how to become healthy. So
That's
pretty
great.
straightforward. But the key point here is how to be healthy. If you look at our current healthcare system, it isn't a healthcare system, it's a disease treatment system. If you look at the history of medicine, there's been kind of, you might say, two schools of medicine. One school of medicine is body is the victim of the environment and victim of disease, and our job is to fix things and cure disease and take over the control of the body. The other school has said, oh, wait a minute, health is kind of a natural order of things. And so the role of the doctor is to understand why that person's body isn't working quite as well as it should, what's blocking that innate healing power, and what can we do to help facilitate it. So one route goes to like drugs and things like that, pre-toxic approaches, but fast. Your symptoms go away real quickly. The disease often doesn't change very quickly. Matter of fact, it typically gets worse, but the drugs get rid of symptoms very quickly. Natural medicine approach is, well, what's wrong? It takes time to figure it out. Is it nutritional deficiency? Is it environmental toxin exposure? Is it some kind of genetic susceptibility? So you look at, can we look at what can we do to make the person healthier? So while we do treat disease with quote natural therapies, we're much more interested in how to help people be healthier. Because when people are healthier, they're more resistant to disease.
That's great. It sounds like a much more proactive approach to health, looking at things before they become a problem that need to be treated with a drug.
Yes.
I take it.
I want to be clear. We need both.
Yeah.
Okay. I want to be clear. I'm not anti-conventional medicine. Okay.
Mm-hmm.
Conventional medicine does a lot of really good things, but it's the good things where you have to have the high level of intervention. And sometimes you need that. But most of the time, that's not what's needed. What's needed is understanding what do I need to do to live a healthier life.
And the nice side effect is when you live a healthier life, you live a happier life and a longer life as well.
Yeah, you look at things like vaccinations. That's a great example. So yes, the vaccinations are decreasing people's susceptibility to the COVID-19 serious infection. But it's only for that. Reality is, well, why aren't people's immune system functioning properly? Remember, the vast majority of people who get this infection don't even know they had the infection or get at worst mild symptoms. So that means the immune system is doing what's supposed to. Why isn't it happening for everybody? So while vaccinations have their place, they're not a substitute for having a healthy immune system. Every day we're exposed to infectious organisms, and our immune system just takes care of it really effectively, way better than any vaccination. So it's good example. Yep.
My understanding is, yeah, and my understanding, you may correct me if I'm wrong, but my understanding is that on any given day, we've got thousands and maybe millions of viruses inside of our body coexisting with other viruses. And as long as they don't get, if one doesn't become dominant over another, we live and are perfectly healthy. Is that correct or close to accurate?
Oh yeah, viruses, bacteria, fungi, things like that. I haven't looked at the data lately, but I saw a study about 30 years ago that really affected my thinking. Basically what they did is they just cultured the throat of 100 people, just cultured the throat. 15% of them had pathogenic organisms in their throat. No symptomatology, no disease whatsoever, because the immune system was kept under control, no big deal. Okay. You culture the skin, same thing happens. So it's not the exposure to the organisms that's the problem. It's the response of the immune system to the organisms that is the problem.
So going back to naturopathic medicine, is there a difference? I hear terms like integrative or functional or holistic medicine. Are those all kind of interchangeable, or are there subtle differences between them?
That's well, so they're not interchangeable, but they're
Mhm.
really similar. And it's almost like you have kind of disease medicine and you have what I might call health medicine. And there's been lots of kind of schools of medicine that have been focused on this health medicine approach. Naturopaths, the chiropractors, the more holistic MDs, the integrative medicine, the functional medicine. They're all kind of around this. How do we make the body stronger? How do we promote health? So it has lots of different names, different approaches for it. Strictly speaking, the most trained physicians of natural medicine, naturopathic doctors, are the most skilled in this. But there are a lot of skilled practitioners and a lot of skilled concepts in this area.
Yeah, I feel like there's so many resources available online. There's so many podcasters now and
Mhm.
blogs and just great books that are out there, like the books that you've written, where it seems like
Yes.
we have more access to that side of the medicine than ever before.
Yes.
So I gather that a naturopathic doctor uses the title ND, as opposed to a traditional doctor as an MD. Are there doctors that are both?
Yes. There are some people get both degrees. Not very common,
Okay.
but there are some.
And would you guess that they normally start out as an MD and then there's
Goes both
it
ways.
goes both ways? Okay.
Yeah.
um, and you mentioned there are times when we need the more traditional approach to medicine. I take it this is things like when an arm gets broken or a very acute condition, or a disease. But it sounds like they there's not a whole lot of proactive approach in a more traditional MD approach. It's
Well,
really,
let's
hey,
go.
come in when I'm sick.
So let's go with that term traditional.
Mhm.
Define traditional. Natural medicine is far more traditional than drug medicine.
True.
Drug medicine is relatively recent phenomenon compared to these healing arts, like they've been around for since we evolved as a species. When you look
Mhm.
at Hippocrates, Hippocrates was a naturopath, no question about it. Okay,
That's
so
great.
yes, many areas where conventional medicine is miraculous. I mean, somebody has an overwhelming infection. Here's an example I give students in class. So, okay, a patient comes into you with lobar bacterial pneumonia. Just easy diagnosis, fevers, rusty colored sputum, listen to their lungs, congested, et cetera, et cetera, et cetera. I can treat them with natural medicine. It takes me 2 weeks of hard work. And I have to worry that at 3 o'clock in the morning, we get a phone call from the patient saying, I'm having trouble breathing and my lips are turning blue. Okay. You can do it. I've done it. I treat people with bilobar bacterial pneumonia, really severe, got them through it. Or you can give them the appropriate antibiotic, and within 3 days, that infection is under control. So so I tell my students, don't get overstuck with your
Mhm.
philosophy. Recognize our philosophy is great, but it doesn't mean that's the proper pathway for all patients at all times. So sometimes you have to use antibiotics. So I have the prescriptive authority to use antibiotics if needed, and occasionally that's needed. I once did now this is a while ago because I'm not in primary care anymore, but in primary care, I just did a survey of 100 consecutive patients to see how many of them did I have to refer for drugs. The number was less than 5%. All the rest of them, my approach was better. But for 5% of them, the drugs were the way that they needed to go. And one of my challenges was often people who came to see me were so disenchanted with conventional medicine, I had to twist their arms to say, no, you got to go to the emergency room for this particular one. But a lot of patients wouldn't even do that.
Well, it is hard because we are so accustomed to being overprescribed, for so long that we
Yes.
really don't want to take them even, and that's the irony of it, right? Is that when you do actually need it and it's the most effective medication, some of us are so fatigued by
Yes.
by the barrage of antibiotics. What what things are particularly broken in the US medical system in your mind? Because we hear a lot about this, about the ballooning costs and wait times. And what are the things you think that are particularly broken?
100 years ago, the naturopathic doctors, ones who founded this profession in the United States, said that if you treat acute disease with suppressive medications, you get more chronic disease. So what were they saying? What were they saying according to the language at the time? They're saying that if you use drugs to treat the symptoms of the disease to alleviate the suffering, there's nothing inherently wrong with that. But if that's all you do, you haven't dealt with the causes of the disease. So therefore, you'll get more chronic disease. And guess what happened? They were exactly right. We now suffer the highest burden of chronic disease in every age group ever in human history. So something's wrong. So we gave the conventional medicine all the power, all the authority, all the money. Okay, they say, yeah, we're going to take care of healthcare. We're going to give the best healthcare system in the world. Well, in some areas, yes, it is the best in the world, but for most of the areas, it was a miss. I'll just be blunt. Actually, I've been doing this for a long time. I've been involved in medicine now for literally over half a century. I started working in conventional medicine research before I even heard about natural medicine. So I've looked at this pretty deeply. And as I've gotten older, and as I've had the chance to see over time what happens, I'm actually more radical than when I was when I first got into the profession. Because now in my age group, I'm seeing family and friends in my age group dead, suffering severe chronic disease, or pretty much done with life. And yet those I know who live the healthy life, they do so much better. So, I mean, my wife, Laura, and I lecture literally all over the world. And when I go to a foreign country, I invite my wife to come along and we'll rent a motorcycle, go touring in a foreign country. My friends, they can't get off the couch, okay, if they're still alive. I mean, not all of them, of course, but way too many. It's really sad. So what are the problems? The drug model is in some ways illusionary. Because if you define success as relief of symptoms, or if you define success as in diabetes, well, make sure the blood sugar levels don't get too high. Okay, well, these drugs are pretty good. But if you define success as restoring proper physiological function in the body, those strategies don't work. So look at diabetes. So I was in naturopathic medical school half a century ago. Diabetes affected less than 1% of the population. Now 10% have diabetes, and 1/3 project to get diabetes in their lifetime. What happened? Our genes didn't change. And I suspect you're nutritionally oriented like I am. You might say, well, people consume too much sugar. That's true. People consume too much sugar. But we've been consuming too much sugar for way, way longer than the diabetes epidemic. So by itself, that's not the explanation. Then people say, well, obesity. Everybody's obese now. That's why we have all this diabetes. Now, that's an accurate one. People who are morbidly obese have like a 50 times higher risk of getting diabetes. But here's the fascinating part. Severely overweight people in the bottom 20% of body load of environmental metals and chemicals have no increased risk for diabetes. So I just said,
wow,
way overweight people, let's say they're not morbidly obese, they're just way overweight, okay? Their risk is increased by a factor of 20. But if the fat's not full of toxic poisons, they don't get diabetes. So what's going wrong? So the MD is saying, well, see, we're keeping people's blood sugar under control and we're decreasing the sequelae of diabetes. They're going to have less, fewer of them are going to lose their eyesight or lose their kidneys or peripheral circulation. And that is true. But the underlying cause for the diabetes has not been addressed. So it just gets progressively worse and the drugs become less and less able to control it. So we say, well, wait a minute, why do people have diabetes? Oh, environmental toxins. Well, let's get the toxins out and see what happens there, okay? And anyway, I can go after disease, showing how the drug approach shows only short-term benefit, but over time, they just get worse and worse and worse.
Yeah, I've read that statins are actually effective at lowering cholesterol, lowering lipids, but not at preventing heart disease, except in some very, very rare cases. I think that's probably a similar example where we're looking at treating a symptom and not necessarily the underlying problem.
So let me go further with that. You might find it interesting. I wrote an editorial on this about 4 years ago. So at that point, the American Heart Association, some other the big medical associations had set new standards for when statin drugs should be prescribed. And the standards they set said that 40% of people over the age of 50 should be on a statin drug. And the reason they said that is because they're totally safe. And they quoted this huge study, 7,000 person study. I'm not sorry, no, it's a 10,000 person study. and double-blind placebo-controlled, showing less than 1% adverse drug reactions. So, wow, it sounds like a good idea. Prescribe statin drugs to people. But when you look at the study, you realize that it was designed in a way to get the result that they wanted. So they started with a 10,000 person open trial. What's that mean? Everybody got the drug. Okay. And then anybody who had an adverse reaction was taken out of the study, and only those that were left, half got placebo, half got statin drug. And that group had less than 1% adverse drug reactions. Guess out of that 10,000, how many they removed in the open label trial to begin with?
No clue.
3,000 of the 10,000.
Wow.
Right. Now, when you do post-market surveillance, after the drug's been around for a while, then you look at what's the incidence of adverse drug reactions, about 25%. Okay. So what happened to studies to show statins look really good? They took out all the people who reacted to statins.
Stop counting the ones.
If you're in that 70%, well, maybe statins going to be okay for you. But if you're in the 30%, the statin's going to hurt you. How do you know which ones you're going to be in? Well, you hope that you don't have a bad reaction. And in reality, you have a bad reaction. So in the editorial, I actually looked at the incidence of benefit from the statin drugs versus the incidence of adverse reactions. A person was 8 times as likely to have an adverse reaction than a benefit from the drug. Wow. There are so many drugs where the research has been presented in a way to make the drugs look way better than they actually are.
Well, I hear statins are actually very effective at lowering testosterone and a whole bunch of other hormones that we need as well that are built out of cholesterol. Imagine if we had 40% of adults over the age of 50 on this. I even heard somebody go so far as to suggest, I don't think it was a doctor, I think it was a journalist, but suggested putting statins in water, much like some cities do with fluoride.
It was an MD.
Wow. That's a really, really scary thought that we haven't learned from our mistakes with fluoride, which I read about in the toxin solution, but I've heard about in other places as well.
Yeah.
So I mentioned the toxin solution, and one of the things that I always kind of appreciated and thought of things as reactive versus proactive or preventative solutions. And I think that can be a useful lens, but you're really adamant in the toxin solution that you have to do both. If you don't fix what's broken already, then your other systems can't take care of things the way that they're supposed to. And so you really can't do one or the other. You've got to go with an all of the above type of approach. Can you maybe speak to this approach of how you go about fixing things that are broken and then maintaining them to keep them from breaking again?
Great. Well, I'm glad you got that message from the book. So I think more and more the public is realizing that they are suffering from toxicity. I think most people probably aren't aware of how serious the issue is, but more and more people will be aware of it. So I go on a detox program. Well, on the one hand, good idea, but on the other hand, there's some problems with that. And that is because of our modern diet and lifestyle, most of our detox systems are not working very well. So I say to people, before you go on a detox program, make sure your organs of elimination, the naturopaths call this the emunctories, make sure the organs of elimination are working properly before you stir things up. Because if you release toxins from the tissues more quickly than the body can get rid of them, you then redistribute those toxins to other tissues. So for example, the kidneys are very high in cadmium and in mercury. Well, if you start doing things to cause them to start releasing those things back into the bloodstream, well, they redistribute back into the brain, for example, where you really don't want these things. Okay, so I say spend 2 weeks learning where the toxins are coming from and stopping the exposure. No point going on a detox program if you continue letting the toxins come into your body. I mean, every day people are exposed to a wide range of toxins in the air, the water, the food we eat, the health and beauty aids. It's all over the place. Then I say, let's spend 2 weeks clean up the gut, because so many people have the wrong bacteria in their gut that are producing molecules that are poisonous to us. So the liver spends a huge amount of its energy detoxifying these abnormal molecules coming from the gut because you got the wrong bacteria in the gut. Old-time naturopathic adage, disease begins in the gut. They didn't come up with this. This is Hippocrates, okay? Way back in Hippocrates, realizing people with messed up guts, digestive dysfunction, they have more disease. It's true. Then we want to spend a couple of weeks to clean up the liver. A lot of these toxins that are in the body, liver is the main way we get rid of them, and we must make sure the liver is functioning properly. And something I've had to do now that I didn't used to have to do is I now say we also have to clean up the kidneys, because we're also seeing a kidney failure epidemic, because so many of these drugs people are being prescribed and so many of the toxins we're being exposed to are really damaging to the kidneys. So then stop the exposure, clean up the gut, get the liver function properly, restore proper function to the kidneys. Now you can go on a detox program. And as you go through the detox program, what people will see is, while it may be uncomfortable to begin with, over time they start noticing, gee, my body's working better. See, I'm not having those as many symptoms. Why? I've got more energy when I wake up in the morning. I'm sleeping better at night. So all these things, I tell my students, how do you know the difference between a suppressive therapy and a curative therapy? I said, well, it's based on what your patients tell you. If a patient comes back and says, well, doc, my joints aren't hurting as much anymore, but I'm just tired all the time, having trouble sleeping, I'm more irritable. You say, oh, doesn't sound right. When they come back and say, doc, thanks for your treatment. And that's got a bit better, but all these other things got better too, which I didn't expect. Okay, you're on the right track then. Okay.
Yeah, no, that's an interesting way to thinking about it. It should make you feel better. One of the best quantitative devices we have is just how we feel.
Yes.
when we wake up and throughout the day. And if
Yes.
you're doing the right things, I think you feel a lot better, and you know it. Whereas if you still feel like crap, it's pretty obvious as well.
I can tell you so many stories of people who were generally unwell, came up from some particular disease, and you put them on the right path, and step by step they get more and more functional. Everything's working better. I love sometimes you gotta be careful about patient confidentiality. Anyway, I'll just
Yeah,
I
no,
have a couple of really interesting cases. I don't think I should talk about those.
Okay, yeah, I've heard a couple of the stories in your books, and there's a whole wealth of knowledge there for sure. So I do want to talk about the toxin solution. I want to come back to it in a little bit, because it really was a fascinating book to me. But first, I'd like to talk about Bastyr and IFM. First off, can you tell the listeners what Bastyr University is?
So I started Bastyr way back in 1978, and it was titled, the name at that point was John Bastyr College of Naturopathic Medicine. We only taught naturopathic medicine. But then as the school evolved and as my own understanding evolved, I realized that we had to be broader than only naturopathic medicine. So I brought in nutrition and acupuncture, Chinese medicine, and physical medicine, and psychology and herbal medicine. We started developing all these other programs to go along with that. So I started Bastyr with a very clear vision, and that is of science-based natural medicine. My belief was that if this body of knowledge was valid, it should be subjectable to rigorous scientific evaluation, and that as we use science, I tell people we do science not to prove ourselves to people, but rather to get better, because that's what science does. Is you want to always learn about, study what you're doing, is what you're doing helping the patient or not. And the only way to determine that is by objective research. So I started Bastyr with a very clear science-based natural medicine approach. And by doing it that way, we became the first accredited university of natural medicine anywhere in the world. Okay, so it was a significant accomplishment and very hard to achieve.
So, but this was pretty early in your career, correct?
Yeah, 1978. I guess that was a while ago, wasn't it? I was doing the math right. It was around 42 years ago. Is that right?
Yeah. So
3 years ago.
Can you maybe speak to what made you think you could do it at that age? Because it's, again, very early in your career. You're I won't say going against the grain, but you opened the first one of its kind in
the
grain, world.
Absolutely. So at that time, so I graduated in 1975, and I was very frustrated with what was going on, because I saw that naturopathic medicine had a lot of healing wisdom, but until it came up to modern standards of education and research and textbooks, I mean, the naturopathic textbook when I was in school had been written the year I was born. That's how far down the profession I'd gotten. Wow. So it's really, you have to have modern textbooks and everything else to be taken seriously, to become the resource for health and healing that our society needed. So anyway, right after graduation, I got myself appointed to the board of trustees of the one naturopathic college left in all of North America, called National College of Naturopathic Medicine at that time. And while I was on the board there, I was meeting with students, and students were complaining all the time, and I could understand why they're complaining. And I said, well, I'm going to spend 2 years trying to get NCNM up to modern standards of education. And if I couldn't get with modern standards, I'd go and start my own school. Now, at this point, I was like 30 years old. Okay. Pretty, pretty naive comment. But I tried for 2 years and I could not get the school out of the bunker mentality. And it's understandable because conventional medicine had destroyed the profession. I mean, at one point, it was licensed in 22 states. There were a bunch of schools. And over a period of about 7 years, the medical profession destroyed the naturopaths. And it went from licensed in 22 states to licensed in only 6 states and a felony in 2 states. And all the schools failed and were shut down with just one school left. And it was only alive because of volunteer work by dedicated doctors. So I said, let's do this right. So I mentioned this to my receptionist. She mentioned it to her mother, and her mother had been one of my early patients. And it was just kind of, you'll enjoy the story. I always considered myself something of a failure for her mother because she came with rheumatoid arthritis. I could only get her about 75% of the way to cure. I couldn't quite get her all the way to cure. And so I was disappointed. But she thought, wow, I'm so much better. I can greatly decrease my drugs I'm taking, not have all the adverse drug reactions. I'm feeling so much better. So my receptionist mentioned to her that I was wanting to start a school, but didn't have any money. So she sent me a check for $200. And I used that $200 check to start Bastyr University, John Bastyr College of Naturopathic Medicine.
Wow.
And I didn't realize it was impossible to start a medical school with $200. But I was young and a lot of energy and smart and articulate and son of a gun, I was able to do it.
Well, $200 in 1978 was a lot more than now, but still starting a school on $200. That's really cool. But there's a whole bunch of stories we could talk about along that process. Did you have role models or mentors that helped you along the way to that point?
The main mentor for me was Dr. Bastyr. So he was, so as I described to my students, he was a healing physician. And that's what I wanted to create. I want to create more healing physicians. So it's two sides. So the healing is that ability to facilitate within each patient their belief in the ability to get better and have the right kind of skills for doing that. Okay. But the physician part was high-level skills, high-level diagnostic skills, high-level therapeutic skills, and being very scientifically oriented. You can do both. And a physician healer is what I wanted to create, and we've created many such. And so Dr. Bastyr was my role model for that. In terms of starting the school, kind of had to figure it out while I was going along.
Can you explain for the listeners what IFM is?
So that's the Institute for Functional Medicine, and it was founded by Susan and Jeff Bland. Okay, and it was to a lot of similarities with naturopathic medicine. You might say kind of the more scientific part of it is real focused on how do you facilitate restoring human physiology, because that's what it's all about. I mean, disease is kind of the end stage of human physiology failing. So let's get earlier in that process and get physiology working better. So Jeff got together a group of people, including myself, a bunch of good clinicians and thinkers, and we got together and a bunch of special people created this model for basically teaching healthcare professionals how to think about patients in a curative manner. So it's been very, very successful and very effective.
Interesting. And then I mentioned IMCJ. Can you let the listeners know what and why that exists?
So that's our abbreviation for Integrative Medicine, a Clinician's Journal. So this is a journal I'm the founding editor of, and we're now in, we're in about year 20 now, I think. Okay. And the idea was to, in a very rigorous scientific manner, recruit papers and articles and commentaries and such around this medicine that were based on science. So because we did it in a rigorous manner, we're indexed now in PubMed, which is really important. So now as we talk about various problems and how to go about deal with them from this perspective, it's in PubMed. So you can find it when you look for things. So around COVID-19, for example, I got together with 3 other really smart clinicians, and we published way back, I think it was in April, an editorial around how to think about patients with COVID-19, how to prevent the infection. When they have the infection, what to do about it. We got the cytokine storm, or the natural therapies you can use, and then recovery, how do you help facilitate recovery? Because each of those 4 stages require very different strategies and very different natural medicine concepts. So fun part about IMCJ is we got articles like that. In addition, we then had particular areas where we have experts in the area delve really deeply into, well, looking at herbal medicine, and that for this condition, which herbal medicines are appropriate, and appropriately or specifically at various stages like the cytokine storm, what herbal medicine should not be used because it could make the patient worse. So it's all
Wow,
about
back in April.
rigor.
So you didn't have a lot of data to draw on at that point, did you?
No. And the good news is that I just recently reviewed it, and we were pretty much right on. I don't think there's anything there we would change. But if something comes up, we would change. Well, that's what we'll do, is we'll do
Sure.
a follow-up letter and say, okay, based on what was known at that time, this is what we believe. Then now we've got some tweaking to do because more research is available.
So it seems like there's probably some common threads between these three organizations, between IMCJ, IFM, and Bastyr. Can you maybe speak to how they complement one another, or
Yes.
how they serve one another and interrelate?
Sure. And it comes back to they're advancing health medicine by whatever name. Okay. So Bastyr is the educational institution for people who are, might say de novo practitioners, they're just starting to become healthcare professionals. IFM is focused on educating healthcare professionals. So we've educated tens of thousands, maybe, boy, it'd be interesting to find out what the number is. Maybe as many as 100,000 healthcare professionals over the years in this body of knowledge. And then IMCJ is basically a scientific journal.
Got it. And that's one that anybody can see. So anybody who's doing any kind of research can stumble upon that and learn from it. That's great.
Yeah, if anybody's interested in kind of delving more deeply into many of the philosophical concepts of this medicine, put my name, Joseph Pizzorno, into PubMed and read some of my editorials. Because one of the things I've really enjoyed doing over the time was look at all these concepts that have been around for 100 years and look at them according to current science. Because remember, when they were developed over 100 years ago, medical science was really at its infancy. We did not understand much about physiology, anatomy, and such. We were learning, but it was fairly limited at the time. So the people who developed these understandings of clinical medicine would often have a concept and then try to explain it based on the known physiology of the time. Sometimes they got it right, sometimes they got it wrong in terms of their explanation. Their clinical insights were pretty good. So I went back and started looking at these things according to modern research. And in virtually every area, with one exception, they were right on. I mean, they were just right on. Naturopaths, when they said 100 years ago, disease begins in the gut. Yeah, the research is very clear. A lot of disease begins in the gut. And they said if you treat chronic disease, acute disease with suppressive medication, you get more chronic disease. They're right on. So anyway, I went through concept after concept to show that they were valid. And the only one that I thought needed to be reconsidered was the vaccination area. Because the naturopaths 100 years ago were very, very anti-vaccination. And based on the status of vaccinations at the time, where there were a lot of adverse reactions, that was really valid. But now I think vaccinations are safer. I want to be clear. I'm not a pro-vaccinate everybody for everything. No. Okay. But I'm also not anti-vaccination either, because some people need it. Okay. Mm-hmm. It's unfortunate. I'd rather we work more on promoting people's immune system. But the reality is that many people's immune systems don't work very well. Last number I saw, I have to look at the research again. 1 out of 6 children is on an antibiotic right now.
Wow.
How can that possibly be appropriate? If children need antibiotics that much, they would have all died before.
Yeah.
Those who needed those kinds of things should have died out. They did die out before. But now what's happening is our population is so unhealthy that we have to use all these drug therapies just to keep people alive. It's unfortunate.
It is very unfortunate. And then when you look even a step back in the use of antibiotics in animals, I think I read that 60 to 70% of the antibiotics in the US go towards fattening up cows and animals. And that gets into our systems as well. I mean, we're really under bombardment from every angle, from things that I think at some point were well-meaning, but maybe not well thought out and not thinking from a system perspective. You mentioned conventional medicine kind of crowding out naturopathic medicine. And it occurs to me that you also have an FDA that is pushing an agenda. You've got pharmaceutical industry that's pushing an agenda, because this system works for those big agribusinesses and those big drug makers, for sure, the system that we've got. And you can't monetize health that doesn't require pills, or it's just very hard to monetize health. So you can see everything that was working against naturopathic medicine as all these different forces were coming together.
Yes. My latest lecture is titled Unimportant Molecules, Unexpected Consequences. Okay. So this all started when I was doing the research on natural medicine for COVID-19. So remember this way back in March when we were writing this, so we're pretty early in the process. At that point, there were some early indications that hydroxychloroquine looked like it was useful. Hydroxychloroquine along with zinc and sometimes with an antibiotic. So as I was looking at that, and by the way, I think the research is pretty clear now that early in the process, hydroxychloroquine used with zinc is actually effective, but late in the disease process, hydroxychloroquine is actually contraindicated. Okay, so a lot of the early studies did not make that differentiation, and I think it got a bad rep. Anyway, going back to that, I was looking at that and it's looking like, oh, the way the hydroxychloroquine is working from my perspective was that it functions as a zinc ionophore. What's that mean? It means to get zinc into the cells. And that's really critical because the way the body, one of the key ways the body protects itself from viruses is through enzymes that depend upon zinc in the cells that block the virus from taking over control of the cellular machinery of the cellular machinery to produce more viral molecules or viral RNA and DNA and things like that. So anyway, I was looking at, well, that's interesting. Are there natural products that are also zinc ionophores? And it turns out a lot of the flavonoids are zinc ionophores. And not only that, but a lot of these flavonoids are antiviral, anti-coronavirus viral, for example. Okay. So
Would you put quercetin in that category? That's one that I've
absolutely
been taking since the beginning of the pandemic with zinc every day.
smart. That's what I do as well. Zinc plus quercetin are, and vitamin C, by the way, and vitamin A. Sorry. That's why everybody says, what vitamin should I take to prevent this? Well, that's what I tell them to do. Anyway, so I was looking at that and said, well, that's interesting. So we got all these antiviral flavonoids, and they get zinc into the cells as well, another mechanism. I said, no, what's the level in the food supply? And I started looking at the level of flavonoids in chemically grown foods, what we call conventional growing, I'm going to call it chemical growing, versus organically grown foods. And it turns out many of these molecules are either at lower levels in conventionally grown foods, or they're not even there anymore. As we've grown foods with chemicals, what we've done is we've maintained the color and some of the tastes of the foods, but all these other molecules are not there anymore. So I was thinking, well, now why do plants have all these flavonoids and carotenoids and these other molecules? I was looking at, oh yeah, antiviral, antibacterial, anti-insect, protect the plant from the sun, protect the plant from cancer. So when we eat those foods, we get similar protection, but we remove those protective molecules from the food supply. And what's even more interesting is a number of those, like limonene, for example, is now being chemically modified in the laboratories of pharmaceutical companies to make into new drugs. So we have agribusiness producing foods, deficient molecules necessary for health. We get disease, and then the pharmaceutical industry modifies those molecules that get lost from the food supply, makes them into drugs they can sell as a profit to treat us for the condition that they helped create to begin with.
Wow.
That's a pretty radical statement, but
it is, but
seeing is just so clear.
Yeah, there's so many examples of that where it's just mind blowing the steps backwards that we've taken. I mean, I guess the counter argument could be from agribusiness. Well, there's less people starving than ever before, and this is a much more scalable way to do it. But it seems to me there has to be a better solution that doesn't kill people.
Yes.
It's
yes, they're growing a lot more food on a lot smaller acreage.
Yeah.
Okay, so people aren't starving; they're just getting sick.
Yeah.
Okay, so we can have both.
Yeah, I agree for sure. So these three organizations you've created are obviously game changers. I gather they keep you pretty busy. Although I've also heard you talk about playing basketball for fun. How often do you get to do that with everything that you have going on?
One of the great sadnesses in my life is I had stopped playing 2 years ago. I used up my joints. I had a choice between playing basketball or walking. And I could have take a lot of anti-inflammatories and kept on playing, but at that point the damage was too much. So I had his T-shirt, playing basketball until age 7. Happiness is playing basketball till age 70. Well, I hit 70. I crossed off the 70. I put 80 in its place. I didn't make the 80.
That's unfortunate, but that's great that you were able to play this far along and that you still get to be active and get out there and enjoy yourself. And I think that's what's interesting to me. I listen to a lot of podcasts with longevity experts, and it would be miserable to me to extend life to 120 or 140 years if you don't also make them better. And I think the good news is that a lot of the things that you're talking about and some of the advances in longevity and certain molecules seem to promise to allow us to live much further along. I remember, I'm 44 myself, and I remember seeing 44-year-olds at the time and feeling like, wow, they're at the end of their good years right now.
Right.
And it probably wasn't far from true back then, but now I go to the gym with people who are 50, 55 years old and still kicking butt. It's nice to see that the people that think about it ahead of time and put in the time to care for their health are able to enjoy longer and more full lives, for sure.
One of the challenges with living healthily is that up until about the age 40, or maybe as much as 50, it doesn't matter a lot what you do, because the body has a remarkable adaptive ability, but the damage is being done. Okay, people accumulating toxins, accumulating damage to their DNA, et cetera. And then around mid 40s to 50s, now is when all the disease starts showing up, because people haven't been taking care of themselves. So early on, they don't notice much difference, but they paid the price. And when they get to the 50s, now all the disease starts showing up.
Yeah, yeah. So I would like to switch gears to some of your health recommendations. You've already mentioned a handful here. You mentioned that you're no longer a primary care physician. Do you still practice medicine, or what?
A little bit. I do a little bit of concierge medicine, but my job these days is to teach what I've learned to other healthcare professionals. So, my textbooks and my lecturing didn't happen last year, but I typically travel about 100,000 miles a year lecturing all over the world on natural medicine.
Wow. That's great. So when you were practicing, were there any really consistent themes that you encountered, or that the doctors that you work with are commonly seeing in most new patients?
Interesting question. In general, I saw what I call a bimodal population. So I would see primarily people who conventional medicine has failed and came to me in desperation. That was the biggest group. But there's a small group, and the one which I encourage as much as possible, of relatively younger people who want to live their lives healthfully and want somebody to teach them how. So I did natural childbirth too. I did home deliveries. Okay. That's why I did this with this group. Come in, family, we want to get pregnant. Okay, fine. Here's what you want to do before you get pregnant. Just get as healthy as possible, nutrition up, toxins down. We have time for the baby. Let's do it naturally at home, so you don't get all the chemical exposure and high technology, and help raise your child healthfully. That was the most fun part, because you're promoting health rather than simply treat disease. But the vast majority of people who had failed conventional medicine failed. Now in this group, it was interesting. One of the parts which I was surprised about was the incidence of misdiagnosis. So a lot of people would be treated ineffectively because they had the wrong diagnosis. Now, I'm not going to pretend I'm a better diagnostician than the average MD, okay? But I will say that I was always rigorous in my diagnosis. So somebody came with the diagnosis, I wouldn't just believe it. I'd say, okay, well, let's confirm it. I was surprised how often the diagnosis was wrong. But the other area that was so common was nutritional deficiencies, just rampant. I did a corporate wellness program in Canada 10 years ago, where I did nutritional assessment of 4,500 oil field workers. Okay, so these are basically mainly young men, but there are other women and older men involved as well. Anyway, I tested them for nutrition, and less than 1% of the 4,500 did not have at least one nutritional deficiency. In other words, 99% had one or more nutritional deficiencies. So everybody, they all had deficiencies. Many had many deficiencies.
Are there deficiencies that were more common, or was it kind of just across the board?
Well, vitamin D was most common. That was 86%, if I remember the numbers right. Vitamin A was 60%. Anyway, I don't remember the numbers. Those two just really jumped out at me. They're just such common deficiencies.
I'm amazed at some of the numbers I'm hearing in the analyses of COVID at how much vitamin D deficiency there still is, because that feels like one that over the last 5 years, people have been saying, get more vitamin D.
Yeah. So you've seen the studies looking at not only the incidence of the disease, but the severity and risk of death inversely proportional to people's vitamin D levels. Higher vitamin D levels, less disease, less infection,
I
less
was very
disease, less
proud. I
death.
had my first physical. I'd get an annual physical from an executive doctor who actually believes in a lot of the same things that you're talking about,
Right.
although he is an MD. And I've been working over the last couple of years to get my vitamin D level up. It had been around 30 to 50.
Mm.
Is it nanograms per milliliter? Is
That's the
is
US
the
number,
scale?
nanograms,
Okay,
yes.
and I got it up to 78 this year, and I
Oh,
was very,
great.
very happy about that. I
Great.
hope to get it up to the 85, 90 range, but
Good. Yeah, so 60 to 80 is my ideal number.
okay,
You can go higher than that. Now, if a person has a Black ancestry, their optimal is a little lower. Black people are more effective at utilizing vitamin D than are white people. And
sure.
Hispanics are kind of halfway in between.
I've heard that. I saw that in an early study in Sweden, a lot of the deaths that they were seeing were Ethiopian members of of their population who were living in Sweden, and I guess that they grew up in it, or their ancestors came up and had much more sunlight, and their skin processes the vitamin D very differently. And when you put them in this environment where they're relatively deprived of sunlight further away from the equator, their vitamin D levels dropped to zero, and they had a lot of very early severe COVID cases.
Yeah.
Or maybe it
And,
wasn't Sweden, maybe it's Finland, but
yeah. Well, here in Seattle, when I first started looking at vitamin D, I just started measuring. Everybody knew, myself, family members, etc. And I measured, I think, 35 people. Not a single one had what I would consider the minimum amount of vitamin D that they should have, including myself. Okay, so so yes, those of us living in more northern climes, getting enough vitamin D is a huge challenge. I mean, if you say, "Well, I get outside a lot," that's great, but 6 months out of the year, the sun is low enough in the sky that you don't get enough ultraviolet to activate the vitamin D conversion in the skin.
wow, yeah, I've heard that as well. And some people like my mom and dad, they live in Florida, so they would get a lot of vitamin D. But my mom's had some issues with melanoma before, and so she won't go outside without slathering sunscreen on, and that suppresses your vitamin D production.
Yeah. I assume you're aware of the work of Michael Hollick.
I, I don't recognize it by name, but
Oh, Michael Hollick, MD, did a lot of the fantastic work in vitamin D research. And has been was a lone voice for many, many years. And he got into a lot of hot water about 5 years ago when he, either a journal article or public setting, said, for every person whose life was saved from skin cancer by putting on, sun blockers, it caused 55 deaths from colon, lung, and prostate cancer. Okay. So he was not very popular in the medical community, but you're totally right. I mean, the fear of the sun is just ridiculous. We evolved in the sun. Doesn't mean get burned. That's not good for you. But totally avoiding the sun like a lot of people do.
yeah.
Vitamin D is critical for our health in so many ways.
Well, and I've heard that vitamin D, it helps protect you from skin cancer, ironically. So by cutting off the vitamin D, you're getting rid of one of your natural defenses. I've also heard, I don't know if this is true, but I've heard that glyphosate has been shown to kill off parts of your microbiome that help you process sunlight safely. And so that people who are not eating an organic diet, that the theory was that their biome is sending the wrong signals to their skin, and that they're more susceptible to cancer. Again, I don't know if it's true or not, but you see all these different variables coming together, and it seems like there's so many different combinations, which again is why I think your systematic approach to looking at all the systems and how they work together is so much more effective.
So I haven't seen that particular one. I would not be surprised, but I can't say one way or the other because I haven't actually looked at that research.
Um, so, I really love your detox protocol outlined in the toxin solution. You talked about it. I'll link to it in the show notes. You summarized it great. It's 2 weeks of removing environmental toxins, your food, other things that you give great advice on. By the way, I bought 2 HEPA air filters after.
Oh, good for you. Good.
And I'm thinking about a whole home water filter as well.
Good.
But 2 weeks of removing the toxins, then 2 weeks of detoxing or your stomach, which I understood to be largely working to heal leaky gut syndrome if you have a leaky gut, and otherwise improving the performance of that. And then 2 weeks of the liver, 2 weeks of the kidney, and then you had an optional week where I think you had sauna treatments and some other supplements you could take to really force things out. What is the hardest part of this program for most people? Because when I listened to it on audiobook. When I listened to it, it seemed very straightforward, and just I wanted to jump in and do it. And I did an actual diagnosis of my gut health, and as a first step there. But I'm somebody who likes to do things very proactively. I like saunas. I like cold exposure. I like exercise. I like taking supplements. I like organic food. I take it that a lot of the population probably struggles with this. What would you say are the struggles that people have in following this type of a protocol?
No, that's a very good question. Let me back up a little bit.
Mhm.
In many ways, I think we're bifurcating into two societies. One society, of which we are members, are saying, my health is under my control, and I'm going to take charge. Okay, and so they start systematically making decisions to just become more and more healthy as go along. And the other group, which is the majority of the society, is everything's fine. You know, big gulps. But it's a cheaper way of getting the soda pop. And if something breaks, well, I'll just go to the doctor, and the doctor will give me a drug, and everything will be fine. Well, of course, that is fine in the short term. In the long term, the body breaks down more quickly. So the first thing is people actually making a choice and deciding that rather than being passive recipients of disease, they're active determinators of how healthy they're going to be. That's step number one. Once they've made that decision, then it's a matter of starting to change their habits. One of the things I noticed that's really quite fascinating, and that is the more and more you eat whole foods, real foods, the less tasty all those fake foods become.
I couldn't agree more. I could not agree more.
I used to have my favorites, okay, well, I'm going to break things now and, just go off and snack on something I really enjoy. I know is bad for me. What's interesting, they don't taste as good anymore. Okay. Because once you start going this pathway, that synthetic refined stuff, it just isn't as addictive anymore, not as attractive anymore. So in many ways, it's just deciding to do it because the positive reinforcement people get from being healthier is self-reinforcing.
Yeah, it's really interesting to me because I probably 7 or 8 years ago is when I started getting into really into health and fitness because my metabolism changed on me, and just going to the gym wasn't enough. And I had a terrible diet, and I luckily was able to learn about some good diet practices, good supplementation practices, and those sorts of things. And I lost about, I'd say, over a 6 month period, probably 50, 55 pounds, and just
Wow.
looked younger and was healthy, and people could
Wow.
see it, right? When
Yeah.
they see me. And a friend who was, I'm going to venture, she was 350 pounds at the time and clearly unhealthy and unhappy. She came over, we were having some friends over, and she came over and said, "You look great, John. What did you do?" And I was like, "Well, I cut out all grains and um I don't eat any processed food anymore. I don't eat anything with added sugar. I'm fine getting my sugar from fruits. I eat a lot of healthy vegetables. I eat organ meats. I only will eat organic food, and I only if wild caught fish, and a lot of the recommendations from your book. I probably eat a little bit more red meat than you'd like for me to, but even there I go for the grass." But I told her this, and she goes, "Oh, I'm not willing to do all of that." And I'm sitting here thinking, you're unhappy and you're miserable and you're acknowledging my happiness, and yet this is, what did you do? And I'm like, what could I have said? There's a pill that I took and it fixed it all. And it's frustrating because I see it with friends and loved ones where I'm like, if you could just, if you, the irony is when you start doing the little things one at a time, each one makes the next one easier. And that was something else I picked up from your book. Your body has a capacity to detox, but it's almost a total capacity to detox, and anything that chips away at it, you eventually hit a tipping point where it can no longer detoxify, and then things snowball very quickly. Is that an accurate way of describing that? Or
Well said. Our bodies are remarkably adaptive. I'll give you an example. By the way, everything you just said was, I think, very, very good. So many people believe that once disease begins, the body can't do anything about it. You got to intervene. And there's a study I just read recently. because I was developing a lecture on kidney health. So can I go on a story, or how's our time?
Absolutely.
Okay,
I'm good on time. We're about an
okay.
hour in.
Oh, really? Oh, wow. Okay.
I'd originally scheduled it for an hour 15, but
Okay.
if you've got the time and want to go over, by all means, or
Okay.
I can speed
So
up for you.
let me just do a quick
Sure.
little story. And I find when I tell stories, it catches people better. So I was having coffee with a friend of mine at Starbucks. And by the way, I don't drink at Starbucks anymore because they don't have organic coffee. Maybe they do now, but I haven't been there for a while. Okay. And I just looked across the street and saw, oh, that's interesting. There's a kidney dialysis center there. I think, well, great. It makes it easier for people. And I was kind of curious, I wonder how many dialysis centers there are. So I did a little search and found within 2 miles of my house, there were 13 dialysis centers. I said, what the heck? Then I looked at the statistics and saying, wow, we've got a kidney failure epidemic. What is going on? Okay. So I started looking at why we have a kidney failure epidemic. And once I started doing that, I said, okay, I think there's a lecture here. So I started looking at what are the causes of kidney failure epidemic and what kind of some of the interventions you can do. I started looking at it. Then I was given a lecture in Australia about 5 years ago. And a friend of mine, Kerry Bone, who's a master herbalist there, was talking about a patient he had who had kidney failure. And he put him on his herbal program and he got his kidney function working again. I said, well, that's interesting. So I started diving into the research and I realized, wow, there's so much we can do about deal with the cause of kidney failure and then facilitating kidney regeneration. But one study I saw really grabbed my attention quite intensely. So you probably know there's stages of kidney failure. Okay. And when a person gets to stage 5, they need a kidney transplant, dialysis, things like that.
Okay.
So they took patients, stage 5, EGFR was 15. Now, EGFR is a measure of how well the kidneys are working, and a healthy person is over 70 or 80. And as people get older, it tends to go down. So when you get below about 30, now you're needing dialysis and all that kind of stuff. So what they did with these patients, all they did, this is the only intervention, they have them stop using non-steroidal anti-inflammatory drugs and acetaminophen. So just stop those drug classes. That's the only intervention. 6 months later, remeasured their EGFR. It over doubled. So
Wow.
what I tell the students is when a person's having a problem, the first thing you do is stop the damage. The body can't heal itself. You keep breaking it. Okay, so stop the damage. So here's the situation. Kidneys are failing. Stop the damage. The kidneys regenerated and they doubled their function in 6 months because they stopped damaging them. There's so many examples where the body has tremendous ability to heal if we just stop damaging it and also give it the resources needed to function properly. God, so many examples.
Yeah, that was one that was one lesson I took from your book is that yeah, organic produce has better nutrient content, but more importantly, there's not as much crap in it, and the crap ends up blocking you from absorbing vitamins and causing all sorts of havoc. And ironically, you need those vitamins to detox, and it just creates this terrible cycle that's just really hard to break. And then ironically, you layer on top of it treatments that are looking at symptoms but maybe causing problems even further upstream. And it's a wonder that this patchwork of toxins working against us that we're able to continue to increase lifespan in spite of the fact that there's all of these bad reactions going on and feeding one another. And again, I always thought more of the nutritional benefits, but after reading your book, I'm convinced that it's more about the toxins, even though it is a little bit of both, obviously. But
And I don't know if I've said this in a public venue before because I'm just now becoming aware of it. I believe the body is much more able to adapt to nutrient deficiencies than it is to environmental toxins.
mhm.
The reason I'm thinking this is that as we evolved as species, in various parts of the world and seas and things like this, sometimes there are lots of nutrients available, other times not much nutrients available. We just have to adapt as best we could. But we've thrown a monkey wrench into the works. We put all these chemicals and metals into our bodies that we've never been exposed to before. Our bodies have trouble dealing with them. So they're poisoning our system, so they're harder for the body to adapt.
It certainly seems that way for sure. Um, I'm very into self-quantification. I've got a Whoop strap on here, and
I'm sorry, what kind?
it's a Whoop strap,
I haven't heard that one.
WHOOP. I used to use an Aura ring, which was
Oh,
really good at tracking my sleep and had great battery life. And
right.
then I started hearing more about the Whoop strap, and I think this is better for quantifying fitness activities.
What's it measuring?
So it measures at nighttime. It measures heart rate variability, resting heart rate.
Mm.
It measures body temperature. It measures respiratory rate. It measures your sleep cycles. I don't know how accurate it is. It seems, at least in the ballpark. It
Mm.
measures your amount of sleep, the number of times you woke up, and then it measures your heart rate during exercise.
Mm.
And it gets really good. It's got a machine learning algorithm or multiple algorithms behind it. So the first couple months that I used it, I have to tell the app like, okay, I did a CrossFit workout, or I did a run, or I went hiking, or I did whatever. But then as that model starts to learn how your body reacts to it, it starts to predict, and it'll actually be proactive now and say, I just detected a rowing exercise. Would you like to review it? And but I'm into just self-quantification in general. Do you have, and I've done lots of kits out there in the 23andMe testing, and you were so kind as to let me access your AI, but what are some tests people can take at home that you recommend for their overall health?
Question I'm often asked,
Mhm.
and everybody wants to know, well, I don't have infinite money, so if I have limited funds, what should I measure? Here's what I recommend: liver enzyme GTTP. Now, why am I recommending that? So normally when we're measuring liver enzymes in the blood, we're looking for hepatitis, because when the liver's damaged, it starts leaking the enzymes into the blood. So enzymes supposed to be in the cells are damaged, leak enzymes into the blood. That's how you determine a person has hepatitis. So GTT is also known GTTP, depends on the lab, is one of those enzymes. Interestingly, within the normal range, which it depends on the labs, about 10 to 50, GTT goes up in proportion to oxidative stress and environmental toxin load. So one of the ways in which I monitor how effective a person is being in decreasing their toxic load is their GTTP will go down. So when I first started learning this, my GTT was I think it was 27, and that was 10 years ago. So as I got more and more conscious of this, my GTT has gone down, and I just measured it 2 weeks ago. It was down to 18. So that is really good. So GTT, if it's above about 25, significant increase for risk of diabetes and all other kinds of diseases. So it's a good way to monitor how well people are for detoxifying. The other thing I tell people to do is get the vitamin D measured.
Mhm.
Vitamin D levels are extremely predictive of disease susceptibility.
And how often do you think about testing for those levels? I guess if you have a history of it being good, it's once a year. But if you're in a problematic area or trying a new routine, maybe you test it
Yeah.
quarterly. Or
So yeah, every 3 to 6 months until you've got it
okay,
stable. Then after that, it doesn't have to be very often. I mean, I haven't measured mine for like 5 years because I've got myself to a point where I pretty much know what I need to do to be healthy. I keep learning, of course, but I don't need to do it quite as often.
after reading your book and preparing for this interview, I went and ordered a home heavy metal test from Everlywell. I haven't gotten the results yet, but they test for cadmium, I think arsenic, aluminum, lead, and then they also test for iodine and selenium, which I gather those aren't toxins. Those are things that your body uses to
Not unless the
detoxify.
levels are too high. Yes.
Oh, okay, not unless they're too high.
Right.
Okay. Awesome. So vitamin D, and then the liver enzyme GGT or GGTP. Are
My
there
favorite.
any others that you think
So there's
are
one
go
more
to?
you can do. So those others are available. Any lab will do them. Another one that I really like doing is urinary AOHDG. Now, what is that? So our DNA is constantly being damaged and it's constantly being repaired. And when we've repaired damaged DNA, that piece of DNA that was removed so it could be replaced ends up in the urine. Okay. So the more of that stuff in the urine, the more DNA damage and the higher the risk of degenerative disease and cancer. So once again, as people go on a detox routine and start eating healthier, their AOHDG in the urine goes down.
8OHGD. Okay,
Okay.
I took that
Not many
down.
labs are doing that one. Hang on, I need to check on our time here. I may have just
Sure,
on a meeting.
it's 12:09 your time.
Okay, good. A second. Yes, 12. Okay, I'm good. I'm good till 12:15. But that's all.
Okay, great. I've just got a couple more questions. This has been great. You've answered a lot of the things that I was hoping to cover here. uh, what advice do you have for medical students today who are frustrated with our healthcare system, or with what they're looking at for their future career?
Very good question. Learn your basic sciences very, very well. And then when you get into your clinical sciences, don't throw away your basic sciences. So one of the things I've noticed, my son went through conventional medical school, now is doing his residency in emergency medicine. And by the way, he's not anti-natural medicine at all. He's totally pro, but he also believes in what conventional medicine does well, which is what happens in the emergency room. That's where conventional medicine is really good. What I've noticed is that they have great training in basic sciences. But when they get into clinical sciences, they throw it all away, start learning algorithms instead. So if you're going to get into disease treatment mindset, well, the algorithms are fine. But if you want to get into curing mindset, you got to understand the physiology, because it's easy to poison the enzymes that produce symptoms. It's what most drugs do. They poison the enzymes that produce the symptoms. You have to understand why the symptoms there. The symptoms are there not as something to get rid of because it's uncomfortable for people. Of course, you want that to decrease, but the symptoms are there because the body's telling us what's going wrong. Okay, something's wrong. So you have to understand how to use symptoms to understand where the body's not working properly and then fix it.
And I guess the simplest example of that is, if I have a fever, don't give me something that just takes my fever down, because my body is probably effectively fighting off the disease, and that's why I have a fever.
Exactly.
What advice do you have for technologists and investors like myself when it comes to building applications and platforms that can change the healthcare system? Because I think every technologist I talk to recognize, I think financial services is a very big industry that people have gone after very successfully for a long time. I think people see in healthcare that something's broken. It's over 17% of our GDP goes to healthcare. So it's an industry that technologists and investors want to go after. What advice do you have for those people? And you yourself have developed some fascinating technology, the AI that I mentioned that analyzed my genetic data for me.
So my own personal bias has always been towards what's for the best public good. So if you're going to be involved in medical technologies, go for those that are going in the direction of in some way being curative in nature, not simply symptom relief or making a lot of money. So the heart rate variability thing you mentioned, that's very good, because it's getting at how well does the body function physiologically. So that's what I recommend working on, is those things which move towards cure rather than treatments that people will be dependent on for the rest of their lives. You look at the pharmaceutical industry and look at what are they looking for? Well, they're looking for drugs people will be on for the rest of their lives, because that's how they make the most money. They don't make money from drugs to cure people.
Yeah.
They just use them and they're gone. No, they want drugs people on for the rest of their lives, like statin drugs, for example. Got to take that for the rest of my life. Okay, so that's a great drug for the pharmaceutical industry. Vaccinations. Well, if we now make the population so weak that every time an epidemic comes along or a pandemic comes along, a lot of people are getting sick. Well, now we get to make a new vaccination every year for the newest organism that comes along. Well, it's great for making money and it'll save some people's lives, but shouldn't you instead be looking at why are people's immune systems so weak? That's where we should be investing our money, is how do you make people healthier?
Yeah, absolutely. Well, and I know you've just got a couple minutes here, so I'll go ahead and let you wrap up. I could talk for hours about this stuff, but you've got a lot of important things you're still doing. So we'll let you go. Thank you so much for joining me today, and especially thank you for everything you've done for our healthcare system. It's really inspiring to see what you were able to do, and the clarity that you had at the age of 30 to go create these things that will live on for centuries, hopefully.
Thank you. I appreciate that. And thank you for your work. And let's all of us working together to promote health.
Awesome. Thanks, Dr. Pizzorno. Have a good day.
Thanks.